right, hello. My name is Nikki, and we are in RT 120, and this is our group discussion on clinical experiences. He just said you will be experiencing an environment that is new and challenging during your clinical experience. You may see or hear things that touch you deeply and affect you emotionally and mentally. This is totally normal in a healthcare field. Learning how to think and act like an X-ray tech means processing your experiences and growing from them. So, I don't know if someone else would like to start, or I can start with anything. I can go. I am at Samsung I actually alternate. I started at the Foothill Surgery Center where they just do mainly outpatient x-rays on like surgery patients. And then I went to the urgent care for 3 weeks, and then I rotate to their Pueblo site for 3 weeks, and then I alternate back and forth. So for me, most everyone has been a walk-in patient, so I really haven't seen anything to really like that was really bad or really sad. It's just little minor injuries. But I will say I was there the day that the TikTok came out that from the urgent care, and that was a quite quite a thing for them. So as a learning experience for me, I just, one, don't have your phones out. Obviously, don't post anything on TikTok because you could lose your job over it. And so, social media, big thing, just learning from that. Yeah. So,
I can go next if you'd like.
sure.
And thank you, Nikki. That was very interesting to hear about.
Yeah.
I'm sure it was an event.
Yeah.
So I would say I'm at CMH in Ventura. And my name is Rosie. And I would say the hardest ones I've come across are in the ER when we're in the ER, and we get a lot of trauma and people going through hard days, of course. And the ones that I feel like have been hardest on me, I would say are the children or anyone, a young child. I feel like since I'm a mom, those ones for me are really hard. I have to, step away and I get a little teary-eyed. When I see them cry, I turn into like Mama Bear and I just want to hug them. And I can't because I'm not their mom, but I want to just tell them it's okay. And it's definitely something that's touching for me because I can't imagine my son being in that situation. And it's a difficult day for everyone, the parents, the child, the people treating the child. It's a hard day. So I just try to be there for the parents as much as I can and try to be strong, but it's definitely not easy for me seeing the little ones that come through. Anyone else?
Natalia, we can't hear you.
How to unmute it. Sorry,
There we
guys.
go. Okay.
I could go next. I just wanted to comment with Rosie. I mean, I also don't have some experience with trauma, and I don't really get ch- child. I think like overall the clinical experience that I've been so far, I think I dealt with like five babies, three, but they don't come in like like severe injuries. But I could probably guess that it's just hard to see when you mostly a child coming with a broken arm crying and you really don't know what to do. um I also not work, I mean I also go to Samson clinic as Nikki goes to. um for the experience that I have, they've been good. Not a lot of mean patients. They're really more understanding. and they're patient with you. They understand your students, so they kind of help out or are more understandable. So with that issue, I haven't received any bad negatives, mostly good ones. I get a lot of patients who come in with the humor. I know that that's one of the communications or interactions that you kind of have to like know where to bring humor and when is appropriate and when is not to. Um, I usually don't come in with humor. I don't. If they come in and they want to do a conversation and they bring like a comment that's like humor, you're like, oh, okay, ha ha ha. But to go as far to like joke around and be like that, that's not really professional. I think that's one of the in the play closet. I think as Professor still mentioned about it, you don't want to come into the room and start making jokes. Let them start um, with the joke, and if you want to comment, that's fine. But know when is not appropriate, when is appropriate, and when is not. Um, but yeah, overall clinical experience, it's been good. The texts are been good. Um, really understanding majority of my X-ray techs that I go to, they're like first year, so they're more understanding and are willing to help you. So with that aspect of the staff, it's been good with, yeah.
I think I was really nervous, like telling patients, like, "Oh, I'm a student," and them not being very understanding. But I've gotten the opposite, where they have been super nice and like, "You can do whatever you want. It's okay." So that's been comforting and reassuring. Um, yeah. And then as difficulty, like the most difficult thing we've had, like very few patients in wheelchairs that we've had to like figure out like problem solving, like how you're going to get this done. But other than that, it's been good.
Yeah, most of the times when you go into the rooms or you go to get them, I'd be like, "Oh, I'm a student. Is that okay?" And they're like, "Yeah, that's fine. That's totally fine." So, I mean, that's pretty good.
Yeah.
That's nice to hear though. Um, I can go next if you guys. So speaking of mean patients, I have one. So I go to Lompoc. So one time um it involved this geriatric patient. So I went to grab him to get chest X-ray exam, and then when he was like he dropped his jacket, and then in his jacket there's this medication box in his pocket. So it dropped, and then I noticed that he was struggling to like kneel down, and then also to like stand back up. So like I offered my help, and then so like I asked him if he'd like to hold into my arm, and then so like he can support himself, and then he responded with something like, "I'd prefer if someone else like help me instead of you." So like yeah, that comment it made me feel a bit sad. Like he was judging my ability to help just because I'm still a student, or is it because of my appearance? Something like that. It made me overthink. Yeah, I was just only like trying to be kind and make sure that he was safe, but I ended up getting that comment from him. So like even after that, I still made a like conscious effort not to let those experience make me biased or like develop any negative assumptions about geriatric patients, because I know that not everyone is the same. And like many geriatric patients I've worked with, like they have been kind, cooperative, and like appreciative. So yeah, can.
I think it's easier said than done to not take something like that to heart, right? Because
Yeah.
yeah, but also like Steele always says, like the patient's having probably a bad day, so they take
Mhm.
it out on you,
Yeah,
right? But
exactly.
it's still like you sit there and you overanalyze, like what did I do wrong in this? But
Mhm.
you just have to be able to like move on and be like make the best of the situation.
Yeah, exactly.
Yeah, I'm still like trying to learn to, not to take things personally, especially with patients, but I feel like with time we'll eventually get used to that.
Mhm.
But as for mine, I'm at Arroyo Grande right now, and nothing really happens there, but there is one experience that I wanted to share. It was when I was observing a spine x-ray being done on a patient, and the patient was, I think she was partially paralyzed. She came in a wheelchair, and she did come with, I think, it was either a relative or a caregiver. But for the spine x-ray, the two techs were trying to have her on like a stand assist so they could have her standing for the spine x-ray. But unfortunately, she wasn't able to go on it, so they just had her, on the wheelchair and they took the x-rays like that. And the whole time the relative looked really like concerned and, kind of like worried, which I don't blame her, because the girl was partially paralyzed. And so yeah, everything went good. The patient left and everything, but later, come to find out, the relative tried reporting that the two techs dropped the patient, which I thought was really like what? Because the patient did not fall at all. But I thought that was like really surprising. But luckily, there was like three witnesses there that saw that the patient was fine and didn't fall. But yeah, that made me realize how important it is to have someone there with you, because it's your word against the patient's word. And I don't know what I would have done in that situation if I was the only one there, because especially with family members, they could definitely misinterpret a lot of things. But yeah, that was one of my experiences there.
And that's a good point. Like you always want to, uh, luckily there were other people there because it is,
Hmm.
you're right, it is their word against yours kind of. And unfortunately, they'll probably side with the patient if no one else was there to, but yeah, it's crazy.
Well, then also it's important to remember ask for help too. If it
Yeah,
is something
Yeah.
you think you
yeah,
need help with, that way situations like that don't happen.
yeah,
And you have more witnesses, the more
yeah,
people that are there. So that's so surprising to hear that. Oh my
yeah.
gosh.
Yeah, I was like, wait, what?
What?
It's crazy.
That's
People.
crazy.
Yeah.
Yeah.
All right. Well, any closing comments from anyone?
I do have a comment for you, Nikki. You know, when you mentioned about the whole Twitter situation, how was the environment? You had patients come in and ask
You
questions
know,
about it,
I
or were
was
there like, I don't.
no one no one ha mentioned it, no, as far as patient wise goes. No, no one mentioned it while I was there, but the other tech said that they had had patients ask them about it. They did say that their foot traffic was a lot less for those
Mm,
first week at least. There was news outside, there was extra security outside. I think, and for me, the people in that video I saw at work previously, and then after, no, none of them. For like 2 weeks, so I think they lost their jobs over it, which is very unfortunate, which just makes you really rethink things and
hmm.
if it's worth it or not. So it's just a learning experience for sure. Like it's crazy.
Yeah,
Yeah.
right,
Definitely a
right.
learning lesson for sure.
Yeah.
People are watching, people are listening, so
Yeah.
you always just want to be,
Is it worth it?
professional. Is it
Was
worth
it?
it?
I
Yeah.
don't think it, I think they missed their mark. It wasn't funny. Yeah.
Mm, no,
So,
because in that time I was in in Samsung.
Yeah,
in Pueblo,
right.
and they were commenting about that, like how could they do that? You know, that's kind of like it not also affects them, but it affects the whole facility
Yeah.
company. Because I would have patients coming Pueblo and telling us about
Yeah,
that, like, oh, what's
right.
going on? And we're like, we're radiology, we're not urgent. I
Yeah.
don't know.
I think
That's
what's crazy about that is that she had it up for 4 hours. For 4 hours, and it was streamed over like a billion times. So just like that small amount of time can blow up into something just insane. So
yeah. You
yeah,
have to have
Definitely.
good interactions with your patients, you know, watch out what you say,
yeah,
how to handle them, you know,
yeah.
because
Because I mean, like it brings up like being sensitive, being respectful, like just all these things that you would hope a healthcare worker would be. So,
yeah.
yeah,
Exactly.
yeah. All right, I'm gonna stop recording now.